Today's April 17th, 2021. This is Dr. Julia, a medical doctor who's primary care. And where did you come from?
Houston.
Long way.
Yes.
And first of all, what did you think of the weekend 2-day workshop?
It was great. Amazing.
You liked it?
Really liked it. Yes.
Worth the cost?
Totally worth the cost. Yeah.
And worth the time. It's
Absolutely.
something you'd recommend to others?
Yeah. This is going to change my practice.
Wow.
Totally. It's going to change my practice completely. So super excited because I'm thinking in my mind like, oh, there's this patient, there's that patient. I just thinking of so many people and so many different things I can offer now that I didn't have before. So
wonderful.
Yeah.
Now, I'd like to talk to you for a moment about something intimate,
yes.
personal.
Yes.
And you're an open woman, and I appreciate that. Last night at our demonstration, we demonstrated. I want the people viewing this to know that we do treat, the participants.
Yes, yes.
And you were a willing participant and asked me to inject your clitoris.
Yes.
And the purpose of that was for sexual enhancement?
Right. And because I've had the O shot before, which, surprisingly was not painful, right? The way they numb you up and everything else was not painful. So I'm like, okay, let's see how this works. And I was very surprised and pleasantly surprised. Like, it did enhance sexual function, I felt.
Immediately,
yes.
And it didn't hurt, right?
It was slightly uncomfortable as far as pressure, but it was not painful like you would expect.
And in your case, we actually did the clitoral hood first.
Yeah.
And then you asked me to do the clitoris itself.
The clitoris itself actually hurt less than the clitoral hood.
That's amazing.
Yeah, probably because of the different mucosa on it. I think the topical that I had put on absorbed quicker in the body of the clitoris as opposed to the clitoral hood. Also, I think you use more volume on the clitoral hood too.
I did use more volume on the clitoral hood. I did.
Yeah, so I felt the pressure there. But honestly, and that was just with a little baby 2% topical lidocaine. When I numb up my patients for the O shot, I'm using a really strong combination of benzocaine, lidocaine, tetracaine that is way stronger than what I had for there. So
understood.
Yeah.
And then you, not too long, within a couple hours after we did this, you went back to your room and you actually tried it out.
I did try it out, yeah. And I felt like my orgasm was 50% better. That's all I can think of it. It was stronger, it was longer, it was great, yeah.
I'm curious, how did it compare to the O shot in terms of helping your sexual enhancement?
So I did the O shot primarily for the stress urinary incontinence.
Understood.
Yeah,
okay.
and I couldn't really tell if it enhanced sexual function for me. I didn't really have, I don't have a problem with sexual function. It was just, I didn't notice that big of a bump in sexual, but it's, like I said, it's hard to tell.
Understood, but this did make a noticeable difference.
This did make a difference.
Thank you.
Yeah.
And I really appreciate your openness, and I may post this.
Yes.
I put these on YouTube. Okay?
Go for it.
Thank you very much. You're kind.